Hello everyone, good evening. I'm Shreya Dhondiyal. As always, it is good to see you. As was predicted, daily COVID numbers have breached the 1 lakh mark. They'll only go up north. As was expected, people all around us are falling ill, especially doctors and nurses. Just today in Delhi's Safdarjung Hospital, more than 160 healthcare workers have tested positive, including doctors and nurses, etc. In Mumbai, 100 police personnel have tested positive. Offices have gone to work from home mode. The All India Institute of Medical Sciences in Delhi has postponed all routine admissions and procedures to deal with the surge that is coming. The hyper hand washing and popping multivitamin pills season is back. As a sense of deja vu sets in, it's time to go back to the basics. What are the medicines you should have in your cabinet? How do you treat yourself at home? Of course, under the care of a doctor. When is it that you should see a doctor? Should you stop sending your child out to play? 4 of India's most respected doctors are answering 10 Omicron FAQs, which means frequently asked questions, for us on the show over the next 30 minutes. You want to hear what they have to say. But before we go to them, let's start with a broad picture of the COVID spread in India and across the world. Take a look.
जरा सी खरखराहट होती है तो दिल सोचता है कहीं ये वो तो नहीं.
Actor Anupam Kher is all of us right now. The first signs of a sore throat will make us wonder if we have Omicron. And whether you're double vaccinated or previously infected, it offers little shield against catching this super mutant variant. Because it's no longer an Omicron wave, it's an Omicron tsunami that is smashing daily infection records the world over. On the 6th of January, the world recorded 300 million infections, or a 71% rise in just 1 week. And the World Health Organization quickly warned against dismissing Omicron as mild.
While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Hospitals are becoming overcrowded and understaffed.
Name any country in the world and the picture is just as grim. Record surges due to Omicron overwhelmed healthcare systems as hospitalizations rise and deaths increasing by the day. In the US, for instance, cases are averaging a staggering 6 lakh every day. That's a 227% rise from 2 weeks ago. Hospitalizations are up 60% in the past 2 weeks. In France, average daily cases have risen 4 times, while hospitalizations have risen by about 70% and deaths have doubled. Back home in India, the third wave is well and truly here. The daily cases crossed 1 lakh for the first time in 7 months.
कोविड का संक्रमण बढ़ रहा है. देश के नागरिकों को मेरा आग्रह है कि कोविड एप्रोप्रिएट बिहेवियर का पालन करें और स्वस्थ रहें.
Since the 1st of January, the total Omicron cases in India have doubled, while in the last 2 weeks, the cases have increased 4 times. Leading the surge are the metros like Mumbai and Delhi. Weekend lockdowns and curfews are fast making a comeback in an effort to stop the spread. Here's how fast the virus is spreading. 179 passengers on a chartered flight from Milan in Italy landed in Amritsar on Thursday, and 125 of the adults on board tested positive on arrival. The only silver lining so far is that there hasn't been a desperate need for oxygen and ICU beds so far, like what we witnessed during the devastating second wave. But the surge is so immense this time that it's likely to overburden an already stretched healthcare system. With NC Satpathy, Anisya Kumar for CNN News 18.
Let me introduce my doctors to you this evening. Dr. Anupam Sibbal is the Group Medical Director at the Apollo Hospital. Dr. Arvinder Singh Soin is Chairperson of the Liver Transplant and Regenerative Medicine at the Medanta Hospital, also the RF Hospital. Dr. Arvind Kumar is the Chairperson, Institute of Chest Surgery at Medanta Hospital, and of course the founding and Managing Trustee of the Lung Care Foundation. And Dr. Ravindra Mehta is the Chief of Critical Care, pulmonologist. from the Apollo Hospital, joining us from Bangalore. Dr. Soin, I'm going to start with you because this show to some extent has been inspired by a tweet that you put out. You said that mild is a relative term. What may be mild for you may not be mild for someone you pass the infection to. What does that mean? Is it your sense that here in India, we are underplaying the Omicron threat?
I don't think anyone's underplaying the Omicron threat. It's only just begun 10 days ago, and the numbers have already gone up 600 or 700%. We had like nearly 1.2 lakh cases a day. But I think that it is also fair to say that although the Omicron infection has been known to be milder than the previous Delta variant, if absolute numbers of infections, let's say, go 5 times, we will have equal rush at the hospitals for patients who need hospitalization. So even though the hospitalization rates are probably going to be 5 times less, but if the total numbers increase 5 or 6 times, and this is what has happened in the US and Western Europe, then we're going to have enough people needing hospitalization, and there's going to be mayhem and there's going to be chaos. So that is why we need to make sure that we protect ourselves, we protect others, so that things don't spiral out of control. What I meant when I said that what's mild for you may not be mild to the next person that you pass on the disease to means that there may be an elderly person within your home or your workplace, they may have comorbidities, they may not be vaccinated, and so on. So obviously, the more vulnerable section of the population are more likely to get severe infection, even with Omicron.
Okay. Dr. Sibal, I'm coming to you here because, Dr. Soin has touched upon the whole issue of hospitalization and how in the United States of America, you're already seeing hospitalizations go up. Currently not at the level that we saw in the Delta peak, but it is. But one of the things that is coming out from the United States of America is this. I saw one report that came from the Texas hospital, a pediatric hospital, which apparently is the biggest hospital in the US. They are seeing very many children, record hospitalizations as far as children are concerned. And it's not just hospitalization. What they are also saying is that at least 50% of them have needed ICUs or ventilators. Is that the experience India is likely to have as well?
Good evening, Shreya. Pleasure to be back on your show. So a couple of high-level points. Firstly, you know that there's this thing that children don't get infected. You know, when we look at the NCDC data from when COVID first emerged in India, about 11% of all those who got COVID were less than 18. So it was there in the first wave, it was there in the second wave, and it will also be there in the third wave. Now, in terms of how children behave, most of them have asymptomatic infection or very mild symptoms, and we are seeing that in the last 4 days or so with the number of families that have got in touch with us with their kids having been picked up because the parents were positive or the kid had flu-like symptoms and the family got tested and the child turned out to be positive. Now, when the numbers increase in a very large manner, and as Avi was rightly saying, it's even if the percentage of those who need hospitalization is small, and clearly we have seen that the world over, that the proportion of individuals who need hospitalization with Omicron is much lower than Delta. But if the absolute numbers are very large, then the hospitalization will happen, and that will and that is what is being seen in the West. That's what has been reported among the pediatric population. But when you look at the need for ICU care and all, we also have to look at comorbidities. Of course, there are children with lots of other problems. In the West, you have a lot of cystic fibrosis, you have lots of chronic illnesses, and children, when they get COVID, when they already have underlying comorbidities, they're more likely to need hospitalization or more intensive level of care.
Okay.
We, of course, are all well prepared. And I was just looking at our data. If we go back to April 6, 2021, when the numbers were about 115,000, which is what we have now. If you look at the hospitalization, I mean, if you look at the Apollo system, for example, we've earmarked 2,000 beds across 39 hospitals in 14 states for COVID. And if we look at April last year, the number of hospitalized patients was 3 times with 115,000 as the total number of new cases per day. So clearly, at this point in time, we are seeing what was seen in the West, with the need for hospitalization being much lower.
Okay.
But if the number of cases explodes, then of course the system will have to sort of ramp up. And that is what is being done in every state.
Okay.
That is what is being done across all hospitals.
Okay, Dr. Arvind Kumar, come in here. There is a question that is being asked, and I'm going from one question to another, and they may seem they are completely different and not related, but these are questions that have come to us which people want answers to. My question to you is this: should we test? Should we not test? Should we just assume कि अगर खांसी में, you know, if you have a sore throat, if you are running a slight temperature, if you have a headache, if you have body ache, just assume that you have COVID, you have the Omicron variant, isolate yourself, take that paracetamol, take that vitamin C tablet, and you'll be okay. What do you do?
That stage in this feeling of complacency of mild infection, which seems to be overread and overreacted by most people.
Okay, Dr. Soin, come in here. The question was, how do you treat a mild COVID at home? I know we are going back to a year and a half, and I also know you're going to say, call your doctor. You don't have to watch this on a television discussion and take, you know, your prognosis for a year. But, you know, what are the basic things that you do need in your cabinet if the symptoms are mild?
So just like last year, you have to make sure that, first of all, you know your temperature. You know that your oxygenation is okay. So
do
it's
you
good
still
to
need,
keep oxygen saturation.
I was about to ask you, do you still need the oximeter, given the fact that for Omicron, you know, at least the experience from across the world is that oxygen levels are not dipping?
No, absolutely yes. You do need the oximeter, because at the end of the day, it's going to be like a mild flu unless one of these things happen. And those things are if the saturation falls to less than 94%, if there is breathlessness, if there is fever for more than 3 to 5 days. And that's the point at which hospitalization may be needed. And I admit that most of us, if we get the infection, will not need hospitalization. But how are you going to know, and how are you going to make it to the hospital in time unless you do this? So yes, you must measure your temperature. You must isolate yourself and protect your family members. You should take paracetamol if the temperature is more than 100 degrees Fahrenheit, and you can take it 3 times a day. And you should hydrate yourself well, eat healthy food, take vitamin C, vitamin D, and that's pretty much it. I don't think we should run after fancy antivirals. I don't think we should do, you know, the Budicort inhalers. Everyone doesn't need them. If you have mild cough and nothing else and just mild fever for 2 or 3 days, you don't need any of these steroids. So do not take steroids at home. Do not run after antivirals like molnupiravir or remdesivir or favipiravir. No. So yes, do all the basic things, and then be in touch on telemedicine with a good physician if you think you or one of your family members needs hospitalization.
Okay. About molnupiravir, Dr. Arvind Kumar, come in here. We've seen how pharma companies are marketing this pill, almost like it is a magic pill. Then is it not? Because, you know, it happened last time as well. I mean, people who don't have any medical background had suddenly become expert doctors in reeling out names of antivirals. But what about molnupiravir? It is being marketed as a magic pill. Is it? Is it not?
It's actually a sad state of affairs that sometimes the over-marketing and hyped-up marketing leads to misunderstanding of some of the molecules as magic pills by large number of people, leading to its mass consumption, and some people, for obvious reasons, encourage it. Molnupiravir is not a magic pill. It is proved to be of benefit in a small subset of patients, those who are 60 plus, those who have comorbidities, who have a chance of the progress of the disease to moderate or severe state, and when they reach there, they have a higher incidence of mortality. So it's a particular subset of patients where, if diagnosed early, this drug has been shown to reduce the incidence of their going into moderate and severe disease. But to suggest that it's a panacea for all, and I think is a very wrong statement. And I would like to use this program to convey a clear-cut message to the viewers that it's not a magic pill. If there is one magic pill to prevent the spread of corona and mortality from corona, it is a rigid practice of COVID-appropriate behavior and use of vaccination. These are two magic pills to my mind.
Okay. Dr. Sibal, parents, many parents messaging me and asking me, ask Dr. Sibal whether it's time for us to stop sending children to parks to play. Look, they have been cooped up at home for the last 2 years, but in the last couple of months at least, you did see parents becoming a little lenient, sending children out to play with their friends, etc. Given the fact that below 15, our kids have not been vaccinated, given the fact that we have seen a rise in hospitalization of children in South Africa and in America as well, is it time for everything to stop and for kids to be locked up at home?
I think that's a really important question that's been raised. It's really bothering parents a lot. You know, this whole swings that we have, school on, off, exams on, off, park on, off. And it is very frustrating for families, very frustrating for children. So now if we are looking at a scenario as we are at this point in time, when we believe that, you know, this wave is going to be the way it is, if not increasing over the next, say, 3 or 4 weeks, we definitely can't keep kids indoor at all times. But, you know, older kids, and I've seen, you know, kids at 3 wearing masks, fancy colored masks with, you know, characters that they fancy. Going out with a mask which is properly fitting and, you know, understanding about hand washing and social distancing. So you want to go into the park, you want to go for a walk, you want to talk to someone, safe distance away, kids can do that. That means they need supervision. And that is fine because you can't really keep them indoors. But, you know, you can't really be out there without a mask. And I want to highlight one point here, and I think this needs to be emphasized, and this is not just for children, parents, it's for everyone. The guard goes down when you have coffee together, you drink tea together, or in workplaces where offices are still on, where you eat together. Now, that is an absolute no-no. We have to, I know we're all social animals, we like to, you know, talk while we're eating and so on and so forth. That's an absolute no. You cannot have tea, coffee, eat with anyone because that's when the mask goes down. So when you're with someone, your mask has to be on and it has to be on properly, you know, not loose. You cannot take your mask down. If you do that and if everybody did that, we would really, you know, score some points against this variant.
Okay. Dr. Soin, I have 30 seconds into this discussion, but I do want to speak to you about doctors and nurses falling ill very rapidly. Today, reports coming in of Safdarjung Hospital where 160 have tested positive. Is that number only likely to grow, and what is it going to do to our healthcare system? We are seeing what it is doing in the, you know, in the United Kingdom. Is that something that could be replicated here in India as well?
Yes, that's that's very relevant. The biggest challenge, I think, is going to be the healthcare workers testing positive in hordes. In fact, you know, I had the news on my own WhatsApp saying that 6 of my core 50 team members have actually tested positive today. So, you know, a lot of people in the hospital are testing positive. But the good thing is they all have mild symptoms or no symptoms at all. And there are ICMR guidelines which say that they have to get back to work in 7 days, and that's safe. But what's going to happen is, on one hand, there'll be healthcare workers falling sick or reporting off sick. On the other hand, there'll be lots of patients, once the numbers climb further, that need hospitalization. So that's going to be a very tricky situation to handle.
Dr. Mehta, then have we come in with precautionary shots or booster shots for healthcare workers too late then?
I don't think that boosters would have really prevented infection. They, you know, boosters and second shots or full vaccination actually prevent severe disease. And therefore, I think perhaps the infection numbers would have been very similar. This is happening in countries where they've had 60-70% of the adult population receiving boosters. Even they have had a lot of infection. So perhaps the infection scenario would not have changed.
Okay, Dr. Mehta, would you want to respond to that? Because Israel seems to be suggesting that after their fourth jab, the antibodies in people has gone up by almost 5 folds. That is what their research is saying.
No, so you're absolutely right. It turns out that your resistance does wane over time and your immunity does come down, especially in some vulnerable age groups. And the booster will at least prevent moderate to severe infection. And the entire onus of this discussion has been to prevent hospitalization. So that is validated. Are we late? No, I think we've gone through organic process. But if you ask me, frankly, a lot of healthcare people have already taken the booster even before the official approval. It was already getting rolled out because we have enough and more vaccines out there. So I think a decision has been made in time. People have moved before the decision. I think we're okay on this front because the booster kicks in 7 days flat, so we're still okay over there.
Okay.
But at the same time, it needs to go to the people who need it, the general population also.
Okay, we leave it there for the moment. Thank you very much, doctors, for joining us. Dr. Sibal, Dr. Soin, Dr. Arvind Kumar and Dr. Mehta. Always good to have you on the show. A quick break. There's some more news coming up. Do stay with us. Welcome back. The US continues to report record number of daily cases with each passing day. And now health experts are saying that preventive measures are the only key to winning the COVID battle. Take a look.
In the fight against COVID-19, growing confusion as America faces more uncertainty. The virus wreaking havoc on businesses, many dealing with more employees calling out sick. Near Buffalo, New York, Starbucks workers walked out over COVID concerns.
The needs of the business are not my concern. The needs of my fellow coworkers and partners and customers are my concern.
The American Medical Association blasting the CDC's decision not to require a negative test for asymptomatic people to end their isolation period after only 5 days. The AMA saying in a statement, quote, "The new recommendations on quarantine and isolation are not only confusing, but are risking further spread of the virus." Many people across the country now struggling to get access to testing due to the high demand.
I think CDC is in a tough spot because there aren't enough tests and they're trying to find alternative ways of moving forward.
The director of the CDC pushing back, denying that the new guidance had anything to do with testing shortages.
If you have access to a test, and if you want to do a test at day 5, and if your symptoms are gone and you're feeling well, then go ahead and do that test.
This comes as the CDC averages more than 574,000 cases each day. The CDC now recommending children as young as 12 be boosted, as health experts predict a rough month ahead.
People should try to do everything they can to be careful and thoughtful about their activities and their masking.
In Washington, I'm Chris Wynn.